What do we got here? Okay, let's go. Let's
Yeah, you the
go.
other chair.
Ladies and
Somebody said, will
gentlemen,
the CEO be wearing black tonight?
what's that? Well, the see up. First of all, hell yeah. I only have one color in my wardrobe. It's a black hat. No, it's a black outfit and a blue hat. There we go. Oh wait, where's the
Pull the chat up.
do a chat up right here?
Nice. We got questions already.
Okay,
Cool,
good.
cool,
Yes,
cool.
yes. Nice. We got one. Thank you, Demi, for your questions. Okay, I got to see that.
We will get to everything.
So we have two awesome questions. One is the black outfit is correct. All right, good. All right, let's see. So today is a marvelous day. We have day 3 of this really crazy, ambitious thing that we're doing, which is literally a daily AMA. Sam, has any? Oh wait, we got a conversation. Sam, has anybody done a daily AMA for this long? For 90 days? Does that make any sense to you?
I don't know of any projects that have done AMAs every day,
That's
but
right.
we can be the first. That's okay.
Yeah.
Yeah.
To be the first.
The first.
It's good to be the
First
first,
ones to do this.
right? It's scary, but it is groundbreaking. All right, so today's topic. So actually, today I wanted to address something very unique. We were talking to a number of social influencers, as we mentioned in the last AMA. That one of the important things that we're trying to do is trying to organize social influencers to become the new microphone, right? To actually to compete with the media powers that come with the large budgets of big pharma. And one of the important things that we're trying to accomplish is really creating a galvanizing movement where they can recognize the importance and significance of being able to create a new way for new innovations to get to the market. Now, what was interesting was how many of the influencers in the crypto space have actually gotten attacked because of all the negative press happening to what we call these shit coins, right, over the last few months. So before we go talk about that, we should make some definitions. So Sam, could you please define shit coin?
So essentially, a shitcoin is any token or project that has a token that's not founded on anything. Yeah, it's just there. It's a meme. Its value is given to it primarily by the community that surrounds it. And yeah.
One would argue that the United States dollar in itself is not founded on anything except for perception. I mean, isn't that not what you just said in terms of currency? Cryptocurrency?
Benjamin Franklin isn't a meme. Okay, he's a founding father, and people love to see him on pieces of paper.
And actually, people died for that country. So.
Before we go further, why don't we just kind of introduce everybody, because we have a whole bunch more people.
We do have some new
listening
guests
in.
here. Oh, you know what? That's a great idea.
Thanks for joining us, guys. Over here I'm Sam. I work with Aevolve. I kind of do all of the digital marketing. I'm the newest addition to the team. To my right behind me, I've got Andy Stein. He is the co-founder of Aevolve, and I mean, really, he's the one who started this journey for everybody a couple decades ago, something like that. And then right over here to my direct left, that is Mr. Vons Santos. He is the CEO of Aevolve. And yeah, you guys want to say something about yourselves?
Okay, good. So we do have some new guests here. In fact, this is day 3, and so for the first 2 days, including today, our goal is to actually keep on creating awareness, and basically asking all of you to keep inviting as many people as you can to actually grow the space. Part of that is because once we hit a certain level, we are planning to make this far, far, far more interesting. So, in terms of myself, my name is Von Santos. The project is Aevolve. I think there's a YouTube channel here which has a bunch of videos where I'm being interviewed. But the story of Aevolve is quite simple. It is a story of a biotech company that actually originated over 20 years ago by this man's father, Andy Stein. Say hi, Andy.
Hey, everybody.
So Andy Stein's father was actually the developer of was a co-developer of a $16 billion drug called interferon, which was the very first antiviral for hepatitis C. And since then had gone to develop a number of patents of immense benefit to the scientific community and medical history. One of them being a technology that we took ourselves to market for him called BetaClear, which is a company called Amolex. So this company actually received an FDA approval for commercial use, and this was related to Alzheimer's. And there's a TED talk out there that we did regarding diabetes, Alzheimer's.
It's called a new weapon in the war against Alzheimer's.
Very good. Actually, you know what it is? It's kind of distracting watching all these
the messages
at
coming
the same time. And anyway, so long story short, we found the technology is my background. We put a team together and we found a solution that could actually create a new financing channel to get new innovations out to the market. So for those that and Sam, why don't you tell them your background and why and how you fit in the crypto space?
Yeah, I have a little bit of a tech background myself, kind of coming more from like the IT space. From there, I moved towards digital marketing. I got involved with crypto late 2016. Made a little bit of money doing giving services in that space, as well as just trying to find the best ICOs. That was really what I did in 2017. Did pretty well and continued kind of growing and learning in the space, consulting for different projects from then until now. And Aevolve is actually the first project, like I've said in the last two AMAs, that I have come on board full time for. Just to give you a little more of a background, I've gone through, I've examined, I've worked with many projects. It's coming up on 2,000 soon. So that being said, I've seen it all, and this is by far the best. Somebody said in the chat, Crypto Whale, if tonight's AMA is good, I am coming in big. You should stay, buddy, for the entire chat. Because
we're here for a very long time. This is the very beginning of something really big.
There's some stuff coming down the pipeline, and you guys, all 25 of you, are going to find out very soon that there is that there is a real value that you're going to find behind this token, besides just people hyping it up and memes and communities and influencers. Right. So. Yeah.
And so, to Sam's credit, aside from being able to analyze over 2,000 crypto companies over the last few years, he is noted as I love when you note that you had a $5,000 that turned into $1 million based on your unique analysis and investment strategies. So yeah. I found that very, very impressive. At the same time, I think the topics that we've discussed, there are many topics to discuss over these AMAs. That's why we're doing these 30-minute segments throughout the next few weeks. And what's important is we try to keep them short. And so the first few days here, we're trying to focus on making sure people understand what this project really is all about. And each day that we will go into deep dives, like the tokenomics of everything, the actual the multi-exchange and multi-protocol strategies that we're launching on, what the timeline is. And in fact, and one of the key things is that on September 23rd, which is why we're leading up the AMAs up to that point, is that we will be announcing on a CoinDesk hosted webinar the first 3 biotech companies that will launch on the Aevolve protocol. And so, I mean, I know it sounds crazy, but we're talking about a token that's actually based on medical solutions. So it could actually save lives by supporting this project.
Right.
So,
Right. Before we go further, can we just explain in just a few sentences what is Aevolve?
Okay.
What is Aevolve?
So Aevolve is a project that's based on developing a way to finance biotech companies, medical innovations. In fact, our actual motto is anything of benefit to the patient, right? And I like to also say we find a way to fund the underdog scientists. And so how do we do that? Right now, in the world of medical research, people have a misconception. They think that if you have a new technology or new medicine, a scientist comes up with the most brilliant thing, that overnight money will fall from the sky and this thing will actually create massive amounts of fortunes and everybody gets healed. Unfortunately, we've all heard the conspiracy theories and the whispers on YouTube and over the years. A lot of it is unfortunately true. There are technologies out there that will not go to market. There are technologies out there, and yes, DB, we will answer your questions, but we will go one at a time. So there are technologies out there that need to get to the market. There are technologies out there that actually are competing with existing products that are making billions of dollars from products that actually only treat symptoms. Meanwhile, they're waiting 20 years, they're waiting 10 years until they make the most money they can from these other products before they release things that actually help people. So at the end of the day, what is Aevolve? Aevolve does something for the people and it does something for the researchers. For the researchers, we will create a platform where we can actually communicate to the masses, to the market. And why is that important? Because unfortunately, researchers are not the best marketers. Right? You can easily accept this. And the patients have to wait for a central group of people to go ahead and decide who gets to, which medicine gets to go out to the market. Basically, you have a group of investors and pools of venture capitalists that literally decide for everybody else who gets to live and die. And it's based on their metrics. What is Aevolve? Aevolve is the patient-driven healthcare system that actually allows us, the people, to decide what gets created, what gets to the market. And so that's us. So and the AVEX token, if you were going to ask that, simply embodies this entire new industry.
Nice.
If I may say, this is the first time in history that scientists and medical innovators from not just America, from all around the world, are going to realize they can actually get the funding of their dreams just by simply shifting the power of who decides on which medical innovations get funded, by giving it to the people, by letting them buy it for themselves. So this is a very exciting time for medical innovation and for healing in the world. Just wanted to make that point.
Nice. So essentially, guys, the last of what we'll say about this before we really start to get into the tokenomics of things and then also answer your guys' questions is that Aevolve is essentially just a company that solves the problem of having a whole, there are biotech companies out there, there are pharmaceutical companies out there that need funding, right? That's the only way that they're going to get their products to market. But there are gatekeepers that, for whatever reason, stop them from being able to commercialize, right? And so what we're providing is a marketplace for them to list their products in advance for patients to see those products on that platform and to be able to purchase reservations in advance. So as soon as that technology or as soon as that treatment becomes available, they'll be able to participate in that. And there's nobody that's more, I would say, qualified to build something like this than these guys, because they spent the last 2 decades, 15 years of their lives building their own biotech company based on his father's research, who was a genius scientist that helped develop interferon, for hepatitis C. He's written plenty of research papers, has plenty of patents, and these are the guys that have kind of carried that legacy forward. And so they saw a problem in the biotech space. They saw companies that weren't able to get funded because maybe Pfizer didn't want them, maybe Johnson & Johnson didn't want them, maybe AstraZeneca didn't want them. And they thought, hey, that's not right. Let's give these guys a chance. And so that's why they've built Aevolve. And the token that powers the entire ecosystem, the entire blockchain platform, is called AVEX. And that's what you guys are invited to right now. That's why we're putting these live streams out. It's because it's super complex. There are many layers. There's a lot of depth. And I know a lot of us are used to meme coins and to the moon and Lambos and this and that. But when you're dealing with healthcare, when you're dealing with people's lives, it requires real thought. It requires time. And so that's why you guys are invited to these AMAs. It's because this is not a joke. I know a lot of you are here to make money, almost everybody. And guess what? You will make money, okay? You will make money. If we do this right and we roll out the way that we're supposed to, and you, the community, helps us and supports us and pushes forward our marketing efforts for people to get to really know what it is that we're doing, then we can really change the world. We can do well for our pocketbooks, and we can save many lives in the process. So that's why we're here. That's why we're doing this, and you're invited. This is the movement. This is AVEX. This is Aevolve.
AVEX for life.
AVEX for life. So why don't we maybe answer a few questions that are in the chat?
Let me address a couple here. Let me see.
Why don't we go
Let's go to the top here. First of all, yes, Beatrice says we are the mighty Oz in the medical field, finding drugs that are helping people or family members that are suffering with their loved ones each and every day. This is exactly right. In fact, I just want to respond to that. What is the vision of Aevolve? I want everyone to know here that everyone on the team knows that the vision here is very large. Just imagine that our goal is that 10 years from now, we will save the life of a child from a disease that we have no solution for yet today, with a solution that we don't even know about today because this platform gave it a chance, right? And so it's a real deal salient thing of how this can actually make real impact. And so we have a couple of questions here regarding some token liquidity, etc. So Demi asked a question regarding the Uniswap, P2P, B2B, and etc. So let's make some things clear here. The token in itself is available with low liquidity on 2 exchanges in Europe, which is the token and P2P, B2B. However, our primary focus right now is also to launch the Binance Smart Chain, and there's a reason for that related to Binance DEX listings. But the Binance Smart Chain in itself is now active on PancakeSwap. For those that are holding the ERC20 tokens, we have already completed the bridge tool. So if you actually look at our Etherscan, you'll actually see bridge activity. So the bridge tool, which allows AVEX from the ERC network to the Binance Smart Chain network to go back and forth. That tool will actually be made available on the Aevolve.health website in a couple of days. So, but the platform has itself been tested, and in fact, these tokens on the PancakeSwap are from that original mint, from the mint from the bridge, right? Let's see. In terms of some questions here, we have regarding the Pancake and Uniswap, the Uniswap liquidity pool was taken down because our focus was to be transferred into the Binance Smart Chain. One of the key things that we did was we got a lot of feedback from the community, especially a few weeks ago, regarding the gas fees on the Ethereum network. So we decided to focus on the Binance Smart Chain because it seemed more practical for trading, and we are reacting to what we believe the market will actually support. What else do we have? Let's see. In terms of and also these AMAs will also give you a really key insight. In fact, in fairness, these AMAs will give you the first to know when we're about to launch on another exchange, another platform, etc., because we do have a roadmap happening. So we decided that we will identify some of them online, but the actual announcements of those key drop dates will happen only here on video, only here live on the AMAs. All right. So let's see in terms of, so we want to be first. We're first right now. Okay. Let's see what else is there. What is it? Electricity. Okay. That's any other key questions? What is the current market cap on package class of 20K? Yeah. So the market cap that we have right now. So I'll tell you what. I think that we actually have a very, very in-depth financial model. In fact, look, Sam here has investigated over 2,000 companies, okay? Which means he studied the tokenomic models of a lot of organizations. So instead of me even touching it briefly, just know that we have a day scheduled specifically just for a comprehensive tokenomic study. But at least, Sam, can you comment at least on what you've studied regarding our tokenomics?
Yeah, I mean, honestly, the tokenomics that you see from almost every other project is very simplistic, at least right now. Elementary at best, right? I mean, we're just being real. It's like 2% to a charity wallet, 2% to a marketing wallet, 2% to like there isn't real deep thought. It's almost an affront to the word economics, putting that
token economics.
It doesn't make sense. When you're talking about real economics, when you're talking about the type of systems that it takes to run something like a country, right? A central bank. That's essentially what Aevolve is endeavoring to do with its token, right? There are a lot of different throttles and levers and things that we kind of take into account. We have plenty of algorithms that are working in the background in order to make sure that we're able to grow the value of the token, but also keep its growth stable, right? What a lot of you guys have seen in the crypto markets is a lot of this, and this doesn't help anybody. Right. Well, most people, at least most people end up losing. Some people really know what they're doing and they kill it. Good for them. But it's very hard to explain because.
Well, how far have we taken it? Have we taken it just from a Excel sheet and a pie chart to no? We've actually.
Yeah, guys. I don't. How else do I say this? These guys got. A Swiss ISIN that was granted to them. Well, it's a financial structured product that is found on the Swiss Stock Exchange.
So, in other words, an ISIN is issued to every stock, bond, or asset that you see on the NASDAQ or on the Swiss Exchange or Japanese or Tokyo Exchange, Nikkei, whatever. At the end of the day, believe it or not, we actually are the first. So you can check avex.ai and actually see this financial product, which is a one-to-one token that wraps, a one-to-one structured product that wraps our token. And that took a year and a half for us to construct. And we actually launched that right before COVID began. So we decided to go ahead and pause that, and it's about to open up again. So just keep in mind something, to create financial products of that sophistication for a company like a blockchain company, we will be here. We will be here to make sure this project goes through because we have a lot of skilled people, a lot of talent here, and we're willing to put in the work. We have put in the work. We are not 6 months old. We are not 3 weeks old. We are years in the making and decades before in preparation.
Yeah.
All right.
Yeah.
So
yeah, we're the ones you want to see.
By the way, I have to call this out. Crypto Whale. Everybody listen to Crypto Whale here. For all purchases on Pancake by Friday, he will double.
Ooh.
All right?
Thank you.
So that means get over there because Crypto Whale's about to jack your price up. So everybody put a heart for Crypto Whale, okay?
Dimmy, you can join the Telegram now. I mean, the Telegram's available. If you look up Aevolve, Aevolve, right? Did I spell it wrong? Yeah, I did, right?
A for Amolex, Evolve. That's
Evolve.
the best way to
Yeah.
remember.
If you just search that in Telegram, you'll be able to find it. Or if you just do the / join Avex, AVEX, you'll be able to find it as well. And that's where we pretty much update the entire community on everything pertaining to the company and the token. We've got a lot of things coming down the pipeline. Like I said, I'm running the marketing. Within the next week or so, you guys are going to see how we kind of revolutionize what it means to actually market a token, okay, and to do it right. We have products. We have products that are coming in place that are going to make it easy for the mass market to get into crypto. Those of you that are in this chat probably have a MetaMask wallet, probably have a Trust wallet, probably manage your own tokens. Most people, your friends, your family, probably never want to do that. Probably never want to set up their own, wallet and write down all the safe words and all of the things that go into that, linking it to your Pancake Swap, adjusting slippage. So we've got a product coming soon within the next week that will fix all of that. So when you send the link out to, hey, go check out Avex, they'll be able to do it pretty easily.
So we have 4 minutes left.
Yeah.
Right. When we put the title out here, we put down, welcome to the era of super coins. Goodbye, shitcoins. Okay, so we all know that if you've been betting in the crypto space, and if you're fairly new, a lot of people have gotten burned this year. Right? And I think what's that saying?
Coin market cap, CoinGecko listing. Yeah, very soon. Very soon.
Yes. Actually,
we're already in the. Yeah, go ahead.
Yes.
Yes.
Okay. So our opening line in the actual thread was, welcome to the era of super coins. Now, a lot of people got burned over the last few months, right? Because you have these meme tokens, they created a lot of hype. We thought that they would some definitely made a lot of money, right? But a lot more lost. Right? And the only reason why they lost is because they were fundamentally meant to not exist. That's the bottom line. All right? These are not long-term plays. These are not assets. They have a saying with relationships, the faster they start, the faster they end. Now, we've been working on this thing for 10 years on the top biotech side. Years on the Aevolve side. His father, a decade before that, 25 years in the making. So we are a slow starter. We are a long laster. There we go.
So that is crazy. Great. So just confirming, we're able to start investing via BSC. Yeah, I mean, we're a cross-chain token. Right now, we're focusing on the BSC side of things, but we're going to move really, really fast. I mean, we love ERC, we love BSC. Our focus right now is Pancake Swap. If you go onto our Telegram, you can see all the links and you can go ahead and get right on in there. You guys are before everybody else. People aren't in this. We have not put out any sort of a marketing push, but it is going to happen. It's going to happen very soon. And all of your favorite influencers and friends, these guys know them personally. And I kind of do too. So you'll see, it'll be great. And one more thing I want to say, we were talking about the intrinsic value of most tokens. You watch the crypto market go up and down, and people are kind of scared right now. Oh, is the bull market over? Well, yeah, I mean, when all you have is code and there's no actual real world, real life application or value behind your token, of course it's going to move with the whims of speculation, right? It's because your value have its feet, I said this yesterday, firmly planted in midair. There's nothing there that it's standing on. But here's the biggest difference, and this is what I want to leave you guys with. This is the reason why I joined Aevolve recently, and I took it serious. I dropped all of my other side projects. You should ask my angry partners, okay? The reason why I joined Aevolve is because think about it. Besides the fact that we're going to help the world and bring healing and wholeness to people that genuinely need it, which matters to me, for those of you that are investors, imagine a token that has the revenues of biotech companies that are making hundreds of millions, billions of dollars flowing through a token, because they are listed on our platform, and we have the rights to those revenues flowing through our ecosystem. What if I told you that we already have that set up? What if I told you that we have a number of companies already waiting in queue, wanting to list on our platform? What if I told you that our corporate wizard, Mr. Mark Chester, COO, former CTO of Ernst & Young, Big Four accounting and consulting firm. What if I told you that he had set deals up, or Rogelio and Andy on the biotech side? I mean, I don't want to reveal too much, but September 23rd, we're going to make an announcement, a CoinDesk hosted webinar, where we're going to announce the first few companies that are going to be listed at the end of the year on our platform. What do you think is going to happen to the value of your token that you hold right now? I know everybody's used to pumping and dumping, but what do you think is going to happen when $1 billion from one listing flows through your token? What do you think is going to happen from one listing? And then what happens when we list the second company, or the third, or the fourth, or the fifth, or the 20th, or the 100th?
Right. And Musashi, it says you'll be the gatekeeper, but with an honest vision. Well, we definitely have an honest vision.
Absolutely.
But we will not be the gatekeepers. We actually are the ones just opening the keys so that the people actually become the ones that put their vote in, make the reservations, and finance these companies.
We're actually just kicking the gate open so everybody can come in.
That's right. We're kicking the gate open.
Hey, because guys, I just want to say this just on like a personal heart-to-heart note. You guys aren't stupid. You know that Big Pharma is corrupt. You know that these guys are hiding cures. I don't want to get too.
Say what you gotta say.
But you guys know that these guys have in 8 months they pulled a vaccine out, but you're telling me decades and decades and decades pass and we still don't have cures for certain diseases, for certain viruses. We still don't have them. Really? No. There are plenty of companies out there that are working on innovative treatments that are FDA approved, guys, that have real science, real patents, real technology behind them, that never get a chance, never get the light of day, never get the green light from the gatekeepers because they disturb existing revenue streams by Big Pharma. What?
Or it's not enough money.
Right.
And you know what not enough money means? That means they put a price tag on a person's life. That's what it means. And so we're all gold, we're all diamonds, we're all invaluable. And so this is why Aevolve is. And for that note, 30 minutes is up. Thank you, ladies and gentlemen. Thank you.
Guys, I'll say this before we go. Please share our Telegram with people, share these live streams with people, because we're going to reveal more and more and more as time goes. I believe we've got 87 or 86 AMAs left before our major announcement.
Who does that? Who does that?
And you guys are going to get used to seeing our face. Please keep sharing. This is something real. It's near and dear to our hearts. And we want you guys. We invite you guys with us.
This is actually for you.
Hey, by the way, Crypto Whale Challenge is right there. Okay, check the thread out. So go on PancakeSwap and do what he said, and he'll do what he said. All right. Thank you, guys.
Thanks, guys.
See you guys.
Thanks for life.
Hey, thanks for life.